Hello, my name is Andrew Nerlinger. I'm the co-founder of PandemicTech and part of the founding team of the Global Health Security Fund, and it's my pleasure to welcome you to Global Health Security Innovation Week 2022. Today we have a keynote session with Pradeep Kakkattil, who's the director of the Office of Innovation for UNAIDS and the co-founder of the UNAIDS Health Innovation Exchange. I'd like to thank you very much, Pradeep, for joining us today, for taking the time to share your thoughts on innovation and global health with our conference community, and very much appreciate your time today.
Thank you, Andrew. Thank you for inviting me to this conference. Looking forward to the discussions.
Wonderful, wonderful. Well, I'll launch right into it because there's so much to talk about here. And I think that really this is quite relevant for a conference that's bringing together the topics of global health security on one side, and then technology and innovation to really think about how we can work together as two communities that have sometimes in the past been siloed. How we can work together to solve some of the challenges that have been highlighted by COVID, some of the long-standing challenges in global health, and some of the things that might confront us in the future. So you have a background in both of these areas. You have a background in global health, but now you've progressed your career to focus on innovation. What was the origin of the idea for creating HIEx, and how did this bring together your interests?
Thanks, Andrew. I think one of the, I've been in health more by accident. I started my life as a filmmaker. And then in the early years, 1990, a good friend of mine tested positive for HIV, and that's how I ended up coming into health, gave up the films. Thankfully, for those of you who follow Bollywood, I didn't end up being a filmmaker. But how I came to start focusing on innovation, AIDS has always been about innovation. But what happened in, I think it was 2018, I was going to turn 50 in a year's time. And I was sitting next to a minister in one of these conferences in New York. That's one of the, I would say, the price you pay for being in the UNS. You sit in various conferences. So I was sitting next to this minister. The session was going on far too long, and then we started chatting. And I was telling him that, look, I'm turning 50 in a year's time. I need to figure out what I'm doing, whether I'm really adding value. Where do I want to go? And then he turned around to me and he said, well, if you were in my country, you don't have to worry for too long, because a couple of years, that would be the end of your life, because life expectancy in several countries, and the country that he came from was about 52, 53. And that took me as a surprise. For you living in Texas, I think the life expectancy in Texas is about 78, 79. Switzerland is 85, 86. So that's about 30 years, anywhere between 25 to 30-year difference in life expectancy. And I said, that can't be. And then when you start digging, we all know this, 1 out of 2 people don't have access to basic healthcare. And I said, we need to do something to change that. And it should be possible. And that's where initially I thought it was a problem of not having enough resources, but I really discovered very quickly that it wasn't lack of money. Money, yes, is important. But it was really the disconnect between the solutions that we have and the challenges that we have. So that's where we spoke with several ministers of health on why they're not using all these solutions. And many of you who are working in technology, you know the solutions that exist, but why is it that countries don't take it, adapt it, and build it on scale? And that's where we started understanding. And that's where we built the Health Innovation Exchange as an independent platform that would work in understanding the challenges that ministers of health face, and try and build a bridge between the people who have solutions and people who have the problems that they're facing and who would love to see those solutions. So that's what we do as Health Innovation Exchange. Find challenges, work with solution providers, and will bring about the trust between those two sectors to speak to each other.
Are there different areas of the world that you found this model to be most successful, or that you focused on, really both because of what UNAIDS is focused on, but also because where you see this model being the most effective?
We found this, again, our focus has predominantly been Africa and Asia. And we have worked with several countries in Africa and Asia, and we used this more as a pilot because initially we wanted to test whether this model works, whether there is really a disconnect, because all of us know that there is a disconnect between innovators and ministers of health or ministries of health. So we wanted to test it. So we have worked. And what is really interesting now is over the last year or so, we have had so many conversations with senior leadership and ministers from the developed world, because there are so many frugal innovations that are coming up in India or Kenya or Rwanda, which is equally applicable in the developed world. Because what we are seeing, I mean, all of us know the cost of healthcare is huge, and we need to really bring about efficiencies. And that's where, even in the COVID response, we have seen many solutions that are emerging from other places that are relevant for the developed world, and we are starting to build those bridges.
It's interesting that you say that, because that was a lot of the story about how TextGHS came about, thinking about how a lot of the focus on global health was, overseas, outside of the US. And then when COVID, the early waves of COVID came, the problem was here in our own backyards. And so we were able to kind of look at some of the local solutions that were being developed, and then look at what else outside was being developed that was relevant. A lot of what we found out is it really fosters, there's a sense of community that's necessary to attack and approach these challenges, to solve these problems. And I think that one of the things that I've noticed about HIEx and your mission is that you're building these resilient communities. Was that an intentional part of the design of HIEx, or was that something that you realized came out of the creation?
I think we started with Health Innovation Exchange initially with all kinds of preconceived ideas on what will work and what won't work. Thankfully, within the first 6 months, we proved almost every assumption that we had made was completely wrong. And we really, thankfully, sometimes what you realize is that within the UN system, you often don't get the space for taking risks and innovating and making changes along the way as you go. But thankfully, we went through a process of transition internally, which helped us to spend about 2 years trying different approaches and models. And the fundamental lesson that we have learned through the Health Innovation Exchange over the last 4 years has been that, one, there are huge disconnects within the health sector, but also between health and the other sectors. And my huge hope is that a good friend of mine recently called for health, now you need not doctors, but much more engineers. So I'm really hoping that we are able to draw in many of you who are engineers and people in the technology sector. The reason why I'm saying that is because if you want to build resilient health systems, you need to think scale, which unfortunately, we who have worked in health, we have not really thought about scale. I mean, otherwise, 1 out of 2 people wouldn't be without healthcare. And number 2 is it has to be efficient. It has to be able to work in terms of the disconnects is what makes it inefficient, and we need to figure out how can you build those systems, and how do you connect those communities together. So that's where what we have been able to do with the Health Innovation Exchange is really look at what is working, where are the gaps, how do you bring these, how do you make these connects happen. And what has been fascinating for me is when you sit with the health minister, and in most countries, again, between 50 to 70% of their health infrastructure doesn't have electricity, which basically means none of our fundamental systems are going to work in terms of information, in terms of basic light, running water. So when you get the health minister and the energy minister to sit down to find solutions, that is when I found that to be really rewarding.
Mm-hmm. Well, one of the things I've noticed that's the most different about HIEx, especially when thinking about the typical mission of a UN organization, is that you work directly with startups. And a lot of the startups and entrepreneurs and innovators that you work with, these aren't necessarily all very, very early stage. Some of the companies that are part of your coalition, part of your group, have raised in the high tens of millions of dollars or more, and have become really successful at scaling. So that interest in working with successful entrepreneurs seems to me to be a very outside of the box solution for kind of a classic global health approach. Are there any kind of really great examples that you can think of innovators that you've worked with, or some of the companies or entrepreneurs making a difference that are part of the HIEx group?
Thanks, Andrew. For me, before I come to the examples, one thing which fascinates me is the number of absolutely brilliant minds out there who are finding solutions to all kinds of problems. The challenge with all the institutions, whether it is multilateral, UN, or the public sector, is that we are far too often inward looking and we are afraid of change. Whereas the approach that we have been able to foster within Health Innovation Exchange is to say, we want solutions, we want those bright minds, we want to connect those bright minds, we want them to work together, and then the magic happens. And when you connect those bright solutions with the policymakers, the people who have that responsibility for delivering healthcare, it's a win-win solution. So it's been, for me, it's been a huge learning experience, and it's been great fun. In terms of the examples, I'll take a few very quick examples, and each one of them, what really amazes me is the story behind the innovator, why they are doing it, and that's really the commitment that people come with is what fascinates me. From something, this was a young engineer who discovered that vaccines were being thrown out because they were being carried in the classic ice box, which doesn't maintain the temperatures evenly, which means quite a lot. Between up to 50% of the vaccines globally is wasted, according to WHO, not COVID alone, but across the board. So he's come up with a simple backpack that health workers can carry. It's by a company called Black Frog Technologies. I hope you will have an opportunity to speak to them. Fantastic. It ensures that people can carry these vaccines out into the field and bring it back and put it back into the refrigerator. Or the ability to scrub into an operation theater wherever you are, by Nadine, who is this amazing doctor from NHS who wants to make surgery, quality surgery, available across the world. Or look at the use of artificial intelligence and use of AI for diagnosis of all kinds of things. We work with one of the innovators who helped to start looking at machine learning and AI for tuberculosis diagnosis. And the big challenge that countries have is that the number of trained radiologists that they have, I won't name the country, but one of the countries with about 12 million population has 3 trained radiologists in the whole country. So how do you do tuberculosis, or if it is a brain injury, how do you assess that? How do you use technology for expanding the capacity, the limited capacity that you have? Or blended medical education. We have an innovator who, a classic medical school will set you back by anywhere between 100 to 150 million and 5 to 8 years. Whereas these guys have set up a blended medical school which produces doctors and nurses of comparable quality, and it costs 4 to 6 million to set up a medical school. And they can set it up in 6 months, which may not sound as a huge difference. Yes, it is, but because when you speak to political leaders, they think in 5-year political terms. So if your medical school is going to come, it's going to take 8 years. There's no interest. Whereas if you can set it up in 6 months, the first batch of nurses and doctors are coming out within your political term. That's a huge win-win. Or telemedicine. I'm absolutely for whatever troubles we have had with COVID and the struggles we have had. What I'm fascinated by is the policy shifts that have happened in several countries at a pace which was unthinkable. The adoption of telemedicine over the last couple of years, it would have taken us 10 years by normal terms. So, and what is also interesting, and all of you know this, in terms of how can you use data creatively. We have this telemedicine company from Brazil which has been doing some amazing work. They are able to predict a cardiac event 72 hours in advance based on the video feed that they're getting through telemedicine. They're able to intervene, and they've been able to reduce cardiac related deaths by 40% in one of the districts where they're working. That is huge. So there are so I could go on as you can see. It's fascinating to see the solutions coming.
And that's a good thing to have, to be able to have so many success stories that you can't actually name them all in a short amount of time. So I think it's really exciting. And I've gotten to know some of those companies and see some of those, and they're very, very exciting. One of the things that's most exciting about them is that several of them have been successful in raising actual venture capital, venture-backed equity investment. This is pretty new in the global health space. I think it's new, especially in the global health security space. I'd like to think that COVID has changed the focus on this, but I'm not always entirely sure. Are you sensing that there's a lot more enthusiasm among investors? Going back for a second, I started my career in telemedicine and digital health venture capital, and now I've been in software venture capital here in Austin. And I think I've learned that investors invest in what they know. Fundamentally, they invest in people and they invest in what they know. And I think that the hope is that COVID has made health security and global health issues feel much closer to home and make it something that investors do know. Have you seen this borne out with some of the companies and with investor enthusiasm and with investor participation in HIEx?
I think it's a mixed bag still. One, there is certainly much more interest and engagement from the investment community to invest in health technologies that are emerging. Excuse me. The challenge that I see is that one, there is overinvestment in everybody's, and again, at this point, I'm taking the entire investment, including philanthropic money that is going in. A lot of that there's the herd mentality. Everybody is now after COVID-related solutions. So that's a danger. But it is much easier to raise money as a innovator in health space today than it was 5 years ago. So that's the good news. However, the investment geographically is not yet, I've not seen, for example, Africa gets what, 0.2% of the total private capital that is being invested in health startups. So there is need for shift in that. And I think what you said is so true. Investors go behind what they understand and what they know. And unfortunately, we have not done enough to showcase the opportunity that's available in the low and middle income countries. And also, we have not done enough to look at a dual market strategy so that everybody is very happy to set up something in the Silicon Valley and focus on the developed world. But with a very small twist, it might be very, very relevant to the low and middle income countries. And in Africa, you're talking about 1.2 billion population and a market where the middle class is growing. So I do believe, I look at it as a cup half full. I do think there is a huge opportunity, and many of our investors have been able to, many of our investors, we run an investor coalition, which brings about 50 odd investors from all kinds of backgrounds, from development financing institutions to venture capital to some of these philanthropic foundations. We are able to bring them together, and all of them are committed to investing in low and middle income countries. So we are seeing a greater interest, but there's a lot more of education. And again, I don't come from an investment background, so I can say this, I'm saying this with a lot of humility. Just as we see disconnects in the health space, we see huge disconnects within the investor communities. The VCs don't necessarily understand the DFIs. They speak a different language versus the family offices and the foundations. I think there's a lot more of that coming together, which would be good both for the impact, but also for sustainability and profitability.
Well, I think this is a great example of you actually doing something about a problem. This problem is not unknown, but I think the investor coalition has actually taken a step towards breaking down those barriers, getting people to talk to each other. And one of the most effective things I think that investor coalition does is it makes people feel more confident in investing in the companies that you're championing. I think that's a really, really important thing that the HIEx has done, but that also should be replicated by others, is finding ways to increase confidence and realizing that these are legitimate investment opportunities. There are a lot of wonderful scalable health technologies out there that we should be investing in, and entrepreneurs, innovators who are experienced, who know what they're doing, who should be targets of venture capital funding or other sources of non-traditional global health funding. So I really applaud you for actually doing something about the problem in the form of the Investor Coalition.
Thanks, Andrew. I think what is fascinating, and probably this is the times we live in, trust seems to be in short supply. And anybody who can help to build that trust, whether it is between governments and innovators or between investors, innovators, and the public sector, because all of us are facing the same problem. I think that's what COVID has very clearly demonstrated. Whichever end you are, whether you're an investor, you're an innovator, you're a public sector trying to provide, you're the ultimate community which has faced the brunt of the pandemic, all of us are in the same boat. So if we are not able to build that trust and start working, and that's where I sometimes get sanctioned by my own team for calling ourselves trust brokers, but that's what we are. We are about making sure that those conversations happen, making sure that the right challenges are addressed by the solutions. And then, again, I mean, the other thing which I should say is that coming from the UN for me initially, and again, coming from Kerala, for those of you who know Kerala in South India, come from a very communist state. But so talking about profit for the UN is always difficult. But if you're not sustainable as a private enterprise, if you're not sustainable as an investor, it just doesn't work. So we need to make sure that it is returns on investment that are also delivering impact, and it's not exploitative. It has to be something which is sustainable, and that's the model that we have been able to do. I'm fairly confident that the kind of resources that need to be invested for addressing the gap that exists in terms of access to healthcare, if we do not bring in the larger private investments to come in, we will never be able to reach that goal.
I think it's interesting now that your success in building this is starting to be really recognized. You were recently named a 2022 Social Innovator of the Year by the Schwab Foundation for Social Entrepreneurship. The announcement happened at the World Economic Forum this year, and really would love to congratulate you on this, and also observe that maybe in your career, the megaphone that you have now in championing this issue may be different than what you expected starting out as a filmmaker. And now I'm going to have to go back and look up some of the film work, see if I can get my hands on that. But you do, through recognitions like this and through the success you've had with HIEx, have an opportunity to communicate the importance of some of the principles and ideas we've talked about today. How do you kind of see leveraging or taking advantage of this platform to kind of champion these issues?
No, thanks very much. The award has been a blessing in many ways, because for us, again, personally, I believe that we live in a very unique time. If we were to look at access to healthcare in the traditional model, if you had to build hospitals and clinics and the primary, secondary, and tertiary structure in the classic brick and mortar style, country after country, it would take us the next 50 years and we'll still be behind. Whereas today we have this unique coming together of three big factors that I see. One is connectivity. With low orbit satellites, we are going to see connectivity on a cable quality connectivity even in the remotest parts of the world, which means you can really build a digital infrastructure for health, which then means you can do it on a scale and speed which was completely unthinkable in the past. That's one. Number two is the solutions that are being developed, whether it is use of artificial intelligence or point of care solutions, the tools which are available for digital health today is just amazing. So we can really use those tools and then overcome by using those tools. You can, because most countries, the biggest challenge is the trained human capacities that is needed for delivering healthcare. So you now have the ability to maximize each health worker's reach as well as the ability to deliver quality services. And number three is that we have new models for scaling, which in the past we did not have for delivering healthcare, including an investment model rather than looking at kind of charity model, which means you have the ability to build in accountability systems which the charity model did not have. So we have these factors coming together. So what I'm hoping, and this is something which I would certainly like to be an evangelist on, is to see how can we really maximize the potential of these three factors coming together to deliver healthcare wherever people are. Geography, I mean, this is again going back to my starting point for Health Innovation Exchange. Just because you're born in a country where life expectancy now is 52, 53, that needs to change, because if we are not able to push that up, we will end up with a system where part of the world is going to be looking at 120 to 150 years as life expectancy with genomics and precision medicine and all those things. And the other half, or maybe more than two-thirds, are going to be still in their 50s. That is not a viable solution. That is just not acceptable. So that is where I'm hoping that I will be able to use my voice to address the potential. And that's where, for me, again, I'm going to say this with, again, as someone who's worked on health, we have not really thought big. And that is a shame, because we have always been looking at pilots and projects in small structures. Whereas I'm hoping that we are able to, and this is where many of the people who are listening, who are part of this, who are from the technology background, who can really set up huge infrastructure for the digital infrastructure for delivering healthcare, and find those solutions which can be, there are probably 20, 30 solutions that needs to come together for delivering primary healthcare. And most of those solutions for the toolbox is already available. So how do you bundle it? That's what I'm hoping this platform can help me do.
Yeah, I think it's exciting that you talk about attacking issues of health equity by kind of scaling health innovations. And when you take a step back, thinking about the innovation community, that's what we're good at. That's what the innovation of the tech community is good at, is scaling solutions and doing it in a financially sustainable, at least, way. And so I think it's really exciting to see, that an event like this can bring together the global health community and the innovation community to look at, identifying the challenges in the global health space, but then scaling the most exciting and promising solutions. And I think really that's what this conference is all about, and really aligning that with how we can fight health inequities. It doesn't matter where in the world they are, here in Texas, and or anywhere else that UNAIDS and HIEx is working. Kind of as we come to a conclusion, I wanted to ask you if there's any other comments or thoughts you might have to share with the conference attendees about ways to kind of more broadly support kind of the mission of UNAIDS, HIEx, and kind of this intersection of technology and global health. How can the private sector, how can people who are not maybe traditional actors in this space get involved and bring their talents, contribute their talents to meeting the missions and the goals we talked about today?
No, thank you very much. I believe that the solutions are all probably out there. And as you said, the innovations community is able to find those solutions. I think the disconnect that exists is between the communities, the ministers of health, the ministries of health. And to be fair, what every one of them has told to me is that please come and understand our pain points. Look at it from our perspective. Don't come to us with solutions, but come to us to first understand so that you can find the right solution. So I do believe that it is very important to listen to what the challenges are, and then to be able to bring, because once we start listening to the challenges, we might have 10 different solutions that needs to come together in a bundle to be able to find the right solution. So that for me, I do believe that we have a huge opportunity. We have the parts of the puzzle. So reach out, connect with each other, and connect. We are very, very happy to connect with anyone who has a solution which you believe might be very relevant to the developing world, or if you have challenges, if you're already doing something and you're having challenges, we might be able to connect you with someone else who has that small little piece of that bigger puzzle that you're holding. So what I've found most interesting, again, as a UN bureaucrat, is that speaking to people and listening to people, and when I speak to you, I get something which I then go and speak to someone else, and they have something else. And then that, when you start breaking those silos and starting to speak to each other, it's just been amazing to see what that results in. So I would certainly encourage people to reach out and speak to others who are either problem holders or others who might have parts of the solutions.
Thank you. I think it's really exciting to see what a strong voice that the UN organizations like UNAIDS have in convening people around these issues. And then also really, bringing confidence and making people really come to the table to help solve these problems. And I think that one of the most exciting things to me is how HIEx has provided kind of a model for how this can be replicated against other challenges in other communities. And so I think that this is a really wonderful thing to think about how HIEx, things like HIEx, can be scaled in the future, and really excited to kind of see the evolution of it as you're leading it. So are there any other thoughts you'd like to share with the conference community?
No, thanks for what you're doing. And I really am looking forward to, I really believe that the solution is spread across the world, whether you're sitting in Nairobi or Bangalore or Texas, wherever you are, the solutions are there. And I think each one of us has a part to play. And for us from the Health Innovation Exchange, we would love to be one of those people who connects the different parts. And for me, my plea is only to reach out. I'm happy to see how we can facilitate.
And thank you very much for taking the time to join us from Geneva today. It's really been a pleasure. We're honored to have you to speak to the conference. Thank you very much.
Thank you, Andrew.